Thanks for staying with us. Remember, we are in conversation with the Health Minister, Dr. Zweli Mkhize, as he continues to take all your burning questions tonight about what exactly you want to know, particularly during this time as South Africa has entered its peak. And Minister, thank you for staying with us. There is a question here from one of the viewers that was recorded earlier, and I'm almost certain that you can be able to hear it and do respond after this.
So right now that we are short with nurses and doctors, and there are a lot of people with qualifications sitting at home without jobs, why aren't they taking people and training them, seeing that we have a need for staff for health?
I'm not sure if you were able to hear that question, Minister, but basically she's asking that with the shortage of health staff, why is the department not employing unemployed graduates to be, able to help out with the shortages?
Well, I got the question. Now, when we say we're short of nurses, that means we can only employ nurses. We won't be able to account for all the graduates. At the moment, we are actually issuing adverts in all the provinces. I'm aware, for example, because we started from the Western Cape and we called for as many nurses as possible. Gauteng is doing the same. They've even compiled a database. And KwaZulu-Natal is currently calling on and employing a lot of nurses. Eastern Cape, we did the same. The last I checked, that actually employed, in about a month or so, that actually employed close to 850 nurses. So all we can say is that send us your details to the department where you're looking for the opportunity, and then of course that should be processed. We're taking as much as we can get. The only problem is other graduates who are not nurse professionals or medically trained or health workers. It may not be possible to employ those. We can only employ those who are qualified and are registered as nurses.
And Minister, another question on Twitter tonight. It's asking, what can we expect in the next 4 months?
Well, what we expect is that the numbers, are still likely to increase. We are expecting that in terms of the models, August and September will still have high numbers, which means more people will be still positive, which means more people may still be hospitalized, and some might lose. But it basically means that at this point is when we expect the numbers to be highest. If at some point I can actually show you a graph that shows you the trends across different provinces in terms of the positive numbers. I'm not sure if it can show on this show, but just to give you a sense that each province has got its own trajectory. So if you go back to Western Cape, it actually went up and had cluster outbreaks early, and it moved up, and then at a certain point, it started reducing the number by which people were turning positive every day. So you'll see a little bit of a plateau that's come up from the Western Cape. And then if you look at Gauteng, Gauteng took off about 6 weeks later, and it started shooting up with the large numbers, up to about 6,000 or so people per day. And then, of course, the numbers are still high, but the trends are showing that they may also start to decrease. But it doesn't mean it's ending. It just means we're not increasing as many as we did before. Same with Eastern Cape, but KwaZulu-Natal is still raging up, and then the other provinces have got lower numbers. So what we should expect, therefore, is that our numbers will still stay a bit high, and therefore we still need to know that it's very, very important for us to keep to the containment measures that we have spoken about. However, we do believe that at some point we will be over this whole problem and this storm, but it will have really meant we should have worked very hard to break the cycle of the infection.
And Minister, we've got Sbu on the line who would like to talk to you about, the state of the Eastern Cape. It does look like this is a province that continues to be of grave concern, as well as what is happening with the Cuban doctors. Sbu, good evening. What's your question for the Minister tonight?
Hi, Bongiwe. How are you?
Good. I'm good, thank you. And you?
Good. Good evening, Minister. How are you doing?
Good evening, sir. Good evening. I'm fine, thanks. How are you?
Sbu, your question for the Minister?
Okay, I've got two. My first question is, what are the action plans to fix the current crisis at Eastern Cape? And two, what happened to the Cuban doctors? Are they assisting in any way Are they making a difference?
Thank you very much, Sue.
Thank you.
Well, thank you very much. You know, the plan for dealing with the Eastern Cape, we've got a plan that has been submitted to myself and the Premier and the MEC that basically goes from hospital to hospital where the crises have been reported, the Doranginza, the Cecilia Makiwane, the Freya Hospital, and a number of other hospitals to say what the real challenges were, what needs to be done. And already from last week when I was there, I got a meeting set up to help the management to be set up to be able to employ as many nurses as possible. And then we've put up an emergency intervention team that must go into the hospitals where we need to do additional beds, additional refurbishments where we can do work very quickly, that they will go on and do that. Of course, the province had actually done a lot of extra beds. They renovated old buildings. They put new beds in there. They've also got, the additional hospitals like the one that was done by VW. And a lot of this has been done because we have actually been preparing for increasing numbers. The old challenges of the province will always remain, and that is the fact that the infrastructure is struggling, and so in some of the areas we can see that you need to get renovations, you need to get additional staffing, you need to get even additional equipment. And what we could provide immediately, we've actually said they must shorten the entire procurement process and make sure all of these are done. Now, every week now, I get a report to see what is the progress on each and every one of those aspects that we said they must be put in place. So I still believe, therefore, that these interventions are going to make a difference in the province, and it is something that there are other areas where we would need a lot more than just the local team to do. We need our reinforcement to go and strengthen those services at that particular level. So that would be our action plan. And then the Cuban doctors are serving in all the provinces. They are making a lot of difference. I think that we probably might be needing more. But right now, what we've been trying to do is to go out to the medical association to get a database to see how many more doctors we can employ coming from unemployed doctors in South Africa, so that they must come on board. We've also brought in the medical students to go and work together with them and reinforce. We've also made an arrangement to work with the private sector, so that where there's pressure, then they should also come in and overlap to cover the health services on the public sector side. We've also agreed with the private sector that they'll make available some of the private beds in case we run short of the hospital beds. We have not filled hospital beds in any province yet. We have also not filled all the ICU beds in any province yet. Although you hear that there's a pressure that hospitals are full, but actually we haven't filled all those beds. So we still think that there's still a lot of room to accommodate, and many more people will still come to us needing admission.
And Minister, we have a question on Twitter from Murolong, who's asking, other countries have entered into purchase agreements with manufacturers of promising vaccines. Has South Africa entered into any agreements to secure vaccines? If so, how many doses?
Well, many countries are still waiting for the successful vaccine trials. They are still being conducted. Many vaccines that are being tried. So no country yet has got any vaccine that is ready. However, we're aware that of some of the vaccines that have been advanced, some of those done by AstraZeneca, others by Pfizer, they think that their processes are far advanced. And so, for example, we're aware that in the US, there was an agreement put up with Pfizer so that we can supply them. We have been in touch with the same companies in South Africa, and we are aware that they have not yet proven the vaccine to be effective. However, we're going to work with them closely. We also work with what is called the Global Vaccine Alliance, which is Gavi, and they are working with us to help us as soon as some vaccines are available, where they're fighting for equitable access. So we are involved in those discussions. Literally every week now we're engaged in discussions about what is the best way of securing the vaccine. The latest that we have been discussing with the Pfizer as a company was that because we do have their practice here, what are the possibilities of us being able to manufacture some of the vaccines inside the country? We'll need a lot of investment. We have not concluded that issue. We've also discussed the question of how do we then, participate in the next batch of vaccine that might be produced if anything is produced by the end of the year. We've actually lined ourselves up to say if they can be registered in America and the FDA, then we need the application to be put into South Africa so that South Africa also can approve very quickly the vaccine, and then we can then try and secure as much as possible what is available at that point. So we have all our eyes out there to check where we can get additional vaccines. But the process is still a bit early, although we're already part of those discussions at the global level.
And Minister, I'm going to ask us just to pause there. We continue to take your questions as you continue to ask the ministers some of those questions that are top of mind for you tonight. And when we come back, we'll give you a chance to continue asking the minister your questions, whether it's on social media or you can even phone in, or you can also send us your voice notes. We continue with the minister on the other side of this. Thanks for staying with us. We continue our conversation with Health Minister Dr. Zweli Mkhize, and we do take your questions tonight, whether on social media. Remember, you can also call in. You can also send us your voice notes as you ask the minister some of those questions that are top of mind. I'll start with Ben Khale, who has tweeted asking, what about movements, Minister, between provinces, since he does not see much screening as he has been traveling?
The question of movement between provinces is a bit difficult to manage. We, at this point, have not encouraged a lot of movement. However, we are not going to be doing screening across different provinces because we are now focusing on prioritizing all the tests to focus on people who are presenting with symptoms, who are vulnerable, who are in the health sector as workers, so that we can reduce the spread of the infection. So we have reprioritized, and we are not doing screening like we used to do before of a community where we put a team to go out, maybe on the road or in the villages, in the townships, in the suburbs, and in towns, and so on. So we're not doing that anymore. So we would not interfere so much with the movement, other than to say it's still not encouraged to be moving large scale, except for the main needs which we have for economic purposes and for urgent issues as such. So the real problem of movement of people is a challenge. It's a challenge even in the same vicinity, because people can move from one area to the other and spread. That's why we have to insist now on saying, distancing and hand washing and all of that has to be taken quite seriously, because you can never know where someone will pick up the infection.
And Minister, I have another question from Tulisi on social media, who's asking, what about recovery and what happens after one is sent home after having recovered?
Okay, recoveries, we report every evening what the numbers of people who have recovered. That is people who have had no symptoms for 10 to 14 days. Earlier it was 14 days, of late is 10 days. And those who have been discharged from hospital asymptomatic and so on. But those numbers increase, and you will notice that if you look back the past 2 weeks, the numbers of people who had recovered was not more than those who were active cases who were still infected. But that has shifted a bit now. You have over 240,000 or so of people who are positive, who have recovered, and less who are still active cases. That basically means that more people got infected and recovered in the past few weeks and months than the numbers that are getting infected now. So there will be more people who are recovering than those who are infected. Now, we classify recovery as someone who would have been without symptoms for 10 days, or the one who has tested positive and remained without symptoms for 10 days. That definition basically means that you may have still be positive in terms of if the test is done. But the latest research is indicating that after 10 days, even if someone is remaining positive, does not mean that they are infective. So they will not infect anyone, so they remain safe after that. And a few people have been reported in some of the countries that after they recovered, they turned negative, they'd been found to be positive. But all the experts say that we must also observe that it does not suggest that those people are necessarily going to be infectious to the next person again. So we monitor that as something that has happened, and then of course we still are looking at the large majority of people who will get the infection once. It is also said that the infection at this point, due to the virus, it does not, the virus has not mutated. So it still has the same features, and therefore it doesn't make it easy for a person to, to get infected, and the body's defense system, the antibodies, will still recognize the virus and deal with it. So it does not create a huge problem like sometimes the influenza does, where you get the same virus and then it mutates after a few months, it infects the same person because it's changed so much that the body doesn't recognize it. So I would still say let's focus on the numbers of people who are recovering and assume that in fact they would have dealt with the infection. The viral shedding is the process of shedding the virus off the body. After 10 days, people tend to be much more safer and secure from getting a new infection or from getting to infect others.
And Minister, there's Monty on the line who has a 5-day-old baby and wanting to know about the vaccine for newborn babies. Good evening, Monty. Your question for the Minister tonight. Monty, good evening.
Yes, good evening. How are you, ma'am?
I'm very well, thanks. And you, your question for the Minister tonight?
Yeah. First of all, I'll just like to say well done to the Minister for whatever he's doing for us. Like, he's doing a great job. But my question around this thing is that, like, I have a 5-day-old daughter whom, like, she went to the hospital, but nothing was ever done for her in prevention of what is happening around the pandemic. Remember, there's people who were born around this pandemic. What is the plan from the government in a sense of, like, protecting them from that? You know, growing up, we used to have our polio and all those things, like we were injected with, like, for you to be protected from this disease or this virus, and then this is an injection for you. So what is the injection or the prevention of another sort in terms of COVID-19? Okay. I would like to understand that.
Thank you very much, Monty. Minister?
Well, thank you very much. Thanks for your kind words. We don't do any vaccines yet, so there's no one who will ever get an injection or a vaccine to prevent the spread of the infection yet until we get the vaccine ready, which will be probably next year, not this year. Secondly, the infection does not become too heavy on the younger kids. So when you look at the numbers of people who are infected, we find that the children tend to get the infection to be either asymptomatic or mild, and so we don't believe that they are extremely exposed to the infection. So that is just the pattern of what we have seen. Also, in terms of the deaths that we have seen, most of the people who have died are more with comorbidities and who are higher in age, around 45, 50 and above. So there's no special preparation that has been done for helping the babies who are born with this infection. However, we have found some children who are positive with the infection with the COVID-19. One case where the baby actually passed, we found that COVID-19 was not a factor in the way that the baby had died. So it was just found to be there simply because the mother had been positive. So it is possible that the mother can pass the infection to the baby, but it's not expected that the risk is too much for the babies to be seriously affected by COVID-19. So we don't have a special program for the children, but it's also because we think that, well, first, there's no vaccine, but secondly, they are not a high-risk group as far as the COVID-19 is concerned.
And Minister, do you understand we've got a question from one of our viewers who were recorded earlier?
Why is the children still going to school? Because it's dangerous to go to the schools. You can catch a corona.
I'm not sure if you heard that question, Minister. He's asking why are children still going to school regardless of the fact that they are in danger and they could contract COVID-19?
Well, there are a number of reasons that we have had to take into account. The first of those reasons is that COVID-19 will be with us this year and next year and maybe even the year after. So we've got to begin to get used to working in the presence of COVID-19. Otherwise, we have to coexist with the virus. So whether we open the schools now or we open the schools later, the chances are when we want to open the schools, COVID-19 will still be there. In fact, I may even hazard a guess that by the time, if we were to close the schools now, even if it's a break, when we do open, the numbers of people who are positive, by that time we open will be higher than what it is now. So there isn't a way we can completely avoid getting the schools to open. The second issue relates to the fact that the distancing and use of masks are the best way of saving everyone from infection, including our children, and that on the studies that have been done, we have actually not got a big problem where children are at risk because of COVID-19. Yes, they could be infected, and that infection has not really caused a huge amount of challenges on the younger people. These studies that have been done in various countries have shown that thousands of children that have been exposed to COVID-19 or even tested positive did not progress into a very serious disease, as it were. So it's a question of us cooperating and working together, and the parents, the teachers, the nurses, the health services, community, we have to work together to try and bring this new culture of how we're going to go back to school, how to go back to normal work with all the masks and distancing and so on. That is really what I think we need to try and focus on. But it's not because we don't care about children. We're actually, all of those who have to take decisions are parents or even grandparents. So everyone is very sensitive about what should happen to the children. But from where we sit, we think that, yes, there's a challenge, but the challenge is such that it is not a reckless move on taking the children to school. It is something that we have to work on, and try and work together and see how we can take it forward.
And Minister, we now have a voice note from one of our viewers, Lechasa.
Hello, my lovely team and viewers. My question to Minister Zweli Mkhize is that he is aware of some communities in Sibidela Makgopong where they don't have access to water to wash their hands, as has been said, and in some hospital at the Sibidela Makgopong where we are suffering to get hot water for patients. We don't have water at all. Sanitation is very poor. This hospital is based at Sibidela Magatle. My name is Lagasa Batla Mollo, Sibidela Makgopong. Thank you.
That's Lechasa there. Minister, I'm sure you've heard the question.
I have heard the question, and certainly I do understand that that area of Mokopong has got challenges of water, and it's a real issue because there are many parts of the country where people have got a challenge even getting drinking water or even safe and clean water. So all I can say at this point is that we'll raise this issue with the minister and the municipality associate that managing this area, so that they must try and expedite and look at where they can get assistance to expedite the provision of water. There has been a plan that has been put in place to support many areas with water and sanitation. I know that the minister has actually released these plans and has gone all out to put up water tanks in some of the areas. I won't be sure which areas are still left out. So if someone is raising this issue, we need to bring it to the awareness of those who are in charge, so that they can act on the request.
And we are taking your questions tonight, and I understand we've got Chaba from Centurion on the line. Chaba, good evening. What's your take tonight?
Thank you very much. The question that I would like to ask the minister is, other than the science, which we understand is still emerging, what else is informing the decision logic to manage the COVID-19 pandemic? There is criticism that other influential interest groups like unions and many others are putting pressure to get outcomes that are not for the good of all and are using their own science or have a different interpretation of the science that government is using. I would just like to get the minister's view to that question.
Minister?
I hope I heard the question. The caller was asking what information informs our decision making, and they have seen that unions are using their own interpretation.
Yes.
Now, yes, we basically use various forms of information. We have modelers that do forecast and give us a sense as to what numbers to expect, and those numbers are varied. They are a kind of a postulation. Then we also use existing data in terms of how many people are found to be positive, how many are hospitalized, how many have passed, and all of that. We pull all of that information together, and then we get a team of experts, the Ministerial Advisory Committee. We ask them to comment on certain things. One area where we've had a huge debate was in the area of children going back to school, and on this issue in particular, the discussion was raised much earlier, around June, to say when we moved out of level 4, level 3, what should be happening to the schools. Our Ministerial Advisory Committee, which consists of researchers, the clinicians and pediatricians who look after the children when they are sick, and then those who look after the adults, infectious disease specialists and so on, we asked them all and we said, what is the risk for the children to go back to school? They said, well, we should let the children go back to school. The sooner they get back, the better, because we'll then adapt everyone on a way of how they should survive in the presence of this infection. And in the process, we then asked about the risk. They did the research, and they checked the number of studies. They found that this was the case. Now, when the unions came up, they were concerned that, well, we say this is the time of the surge. Why do we want the children to go to school? Then we got the experts to come back as well. You might have seen the Pediatric Association, the chairperson thereof came out. You saw the president of the MRC, who is also a pediatrician, Professor Gray. and Professor Saluji, they came out and said, no. They actually have looked at this issue fairly well. I spoke to a lot of others. We've also got Dr. Bamford, who's in the department, who has been working with the Department of Education. We spoke to the head of the department, Professor Velapi in Bara, and a lot of them, they've actually agreed that the risk to the children is not that high, and therefore children can go to school. Of course, there is a risk that children might get infection and pass it to some of the parents or some of the teachers and so on. But similarly, in the community, that's where everybody has been getting the infection. In fact, when the schools opened, all the children who were found to be positive on COVID and the teachers, they had all got it from the community, not from the school, because the schools were closed. So we have to keep negotiating this. What the Minister of Education did then was to go out and consult with all the stakeholders. The majority of the unions then said no, they didn't want to continue with school. And then the parent bodies all said no, they don't have a problem. The children must go to school. And then all the experts, the medical advisory team, the pediatricians, they said no, the children can go to school. And NGOs had different views. So here we're dealing with the best view from the community, not so much as to whether we think scientifically there is anything wrong with the children going to school. Of course, the concern has to be, because the numbers are high at this point, maybe if the children were not at school, it might assist. But the truth of the matter is that children can't be restrained even at their homes. They will have to, they move around, they play around. They could still get infected and bring the infection home. I know of a lot of people, grandmothers who have stayed in the house, never left the house, but have turned positive because the younger ones go out and work and go out to see friends and come back and infect them. So it's a very difficult situation we're all managing. I think it's important to say, let's just work together and use the best available advice and try and move the country forward. We can never say we're all completely correct. We can never say only government is right, but let's talk together and try and see if we can find an understanding that's going to make us move forward. I can just assure you that the decisions we take are always in the best interest of the lives of our people, especially the health of our children.
And Minister, what do you say then as you talk about moving the country forward? The EFF earlier accusing the department of not disclosing the accurate COVID-19 numbers and also calling on the president to return the country to level 5.
Well, I would probably love to engage with the EFF to see what is the concern that they've got. Numbers can be confusing, numbers can be disputed, people can raise any issue. And so I wouldn't really be worried if people are querying the numbers. I can only just say, once we understand the basis of their concerns, we can then discuss it. The numbers that we issue every day in relation to the new tests and so on are well calculated. They are done with the National Institute for Communicable Diseases. We've got teams that try and do everything to verify the numbers and so on. So we do have that, and it's a compilation of work that comes from private laboratories, public laboratories. We do as much as possible there. And if we think there are any concerns, we then go back and recheck and try and see how they can be corrected. The numbers of people who are sick and those who recover, there's an epidemiological spreadsheets that we compile for every patient every day. So if you, for example, if I said there were so many people who passed away or so many new tests, we can actually give you the list of names. We give you the names of the people, give you their ID numbers and so on. You can actually get access to that information if somebody wanted to know where we getting the information from. Then when it comes to other issues, there are numbers where they're not dealing with exact numbers, they deal with models that they do. For example, one of the numbers relates to the deaths, the excess deaths. Now, this issue of the excess deaths comes about because every day, every country can compare from this year to the same day the previous year. What are the possible numbers of people who should have died at that time? Therefore, that model is used to check if there are more people who might have died this year than died last year. And this is what the MRC was talking about. and not necessarily all of it are exact numbers. Some of it are actually models that they use to just give a sense. And even then, those numbers are not indicating that there is anything unusual in our country than what happens in other countries. Because some of the people could be dying of COVID-19, but they didn't reach the hospital, so the diagnosis was not made. You will only catch when you look at the increased numbers of people who have died, and then you realize that something might be wrong. But other people will die for other reasons. And so that whole issue of excess deaths is a huge number of different positions of death. So it's not all COVID, but COVID may well be there. So again, there's nothing that is unusual, but we would allow the scientists to fight over that and decide whether the model is fine, whether it has to be changed. For example, our models, when we started, the numbers were, very wide, and we actually didn't even believe them. But as we moved on and we fitted more and more raw data, which was real, then they started recalibrating or revising their models. So for scientists to debate and query numbers is natural, but if anybody who's not a scientist is unhappy about certain numbers, we'll be very prepared to sit down and listen and see whether in fact there's a reason why we should be concerned about them.
Kabazela, I do understand that we've got Mahlatsi from Pretoria on the line. Mahlatsi, good evening. What's your question for the Minister tonight?
Hi, and good evening, Minister. First of all, I'd like to thank you for doing a wonderful job. But my question was really around our behavioral trends in South Africa. And as our Minister, what has this pandemic revealed about our behavioral trends in light of fighting this pandemic?
Well, thank you very much, Mahlatsi, for your kind words. Let me agree with you that this fight is about behavioral change. This fight is about us behaving differently than we did before COVID-19. The fight can only be won if we all work together to change the way we relate. The hugging has stopped, the kissing, the shaking of hands, the ways that showed our warmth has had to change. The use of masks is now mandatory everywhere. The use of sanitizers, washing of hands, those things are very important. But let me tell you, we went to do, when we walk around, we see a lot of people walking without masks. In some instances, when you ask them where is the mask, they take it out from their pocket. In the Western Cape, we were talking about this issue of taking people for quarantine, saying that that's going to help us to break the cycle. But a number of people refused, and they were saying no, they don't want to go there, and so on. Now, at the end of the day, we rather explain to people and persuade them rather than getting all the time to rely on the police to say, you're not wearing a mask, you're not sanitizing your hands, you're not washing your hands. It's really more about us talking to each other to say, it's going to save our country. This is how a lot of traditions were built up over the years. Something that makes the society survive begins to be a new way of living. And that's where we are. We are actually at a point where we must use this as a way of living and trying to save ourselves from a continuing infection. So it's behavioral change, and it's really got to do with each one person taking it as a personal responsibility that I will make sure if I have the infection, I will not infect others, but if they do have the infection, I'll try and prevent it from getting to me. It's as simple as that, but people take a long time to believe in something that's going to help them. And in some instances, people basically just, they hear one thing and then they decide to take, some of them get carried away by fake news, others like the arguments and so on. That's really why you see the numbers have increased to the level that they are now.
And we'll just get straight to one of the questions that was recorded earlier on in the day.
Why are they digging graves instead of building hospitals? Understand? That's a very, very, very concerning matter.
I'm not sure if you heard that question, Minister.
No, thank you very much. I think that story about graves is an unfortunate one. Actually, as a matter of line function, the issue of graves is not a health function, it's a local government function. However, when in trying to respond to the questions asked by the media, the MEC explained a few things, and then, of course, the story turned to be more about us only focusing on graves. It looks to me like even those graves could have just been the graves that they built for the usual, for the burial that happens most of the time, because we don't have any specific direct link from hospital to the grave as the Department of Health. However, as we sit, I think what we need to say is that our major focus is not so much on that we are accepting people must die. We are accepting that the people will be sick, and we're going to do everything to make sure that we save those lives. That's why we needed more time. That's why we created more beds. That's why we're talking about supplying more oxygen. That's why we're talking about employing more nurses. It's all about trying to make sure that we reduce the numbers of people who we lose because of COVID-19. When we go out and say, let's send a message about containment, about distancing, it's all about saving the lives. And so that message, it doesn't really represent our focus as such. Just that when sometimes you get asked the questions by the media, you have to answer the questions, even if it's not something that is necessarily what you are focusing on. But if you get asked the question, you have to end up answering the question. That was the explanation of the MEC on this matter. But we're not sitting here to dig graves. I think the graves are were being done for weekend burials or the burials that were coming up at that point. But we don't really believe that our focus should be on dealing with those graves. Certainly, where Department of Health will have to focus on, and what we focus on, we do explain to people who have got guidelines. If you happen, unfortunately, to lose any of your beloved, these are the precautions you must take. But our focus is on saving all those lives.
And Minister, I'd like to take another question from the viewers out in the streets who are asking about the infection stats.
Is the actual stats that's shown on TV true? Because there's so many people that we know with COVID. Because it doesn't actually make sense when you come onto a daily basis with new people that knows people that got COVID, and like everyone you know now has COVID. That you know people that someone knows somewhere somehow.
And Minister, before you answer that, I'd like you to just also add this to those questions. Does the number of recoveries include those who are isolated in their homes, as you answer around the stats?
Yes, certainly. Anyone who has been diagnosed positive, and therefore that person will be on our stats. We record them. We record the name of the person, the address, where they are they isolated at home, are they isolated, are they treated in the hospital, are they in ICU, are they in oxygen, and what date did they go into isolation, do they persist being in hospital, or are they now discharged, and so on. The epidemiologists are recording all of that. It's a whole spreadsheet that records, it tracks every person that we have recorded as being positive. So all those who are recorded as positive will find their name somewhere in the stats in that particular district so that we are able to track them properly. So the stats, so far as that part is concerned, are accurate. The question that's been asked, in a way, it's a very important point to make. And the point is that the numbers of people who are infected you can never be sure about it, because the numbers of people that we see are those we test. So we'll record those that we've tested positive. But when the infection goes as wide as it has done, we're finding that there are many who have got no symptoms. So if somebody didn't get sick and may not have been tested because they didn't come to see the doctor and didn't come to see to the hospital, you may not be able to find them except if they were linked to someone who was positive, and therefore we can go and find them as contacts. So there will be those people who will not be tested, and therefore the numbers of people that are positive who have had an infection may always be more than those that are actually recorded as positive. Now, it's important to raise that point because in every country, the question has always been, of the numbers that are tested, how many can we be missing who are asymptomatic and yet positive? Some of the children, for example, would have a few days of an infection and clear it. Even when you test the whole family, you find that some of the children, they might have a test today which is indeterminate, and then when you come back the following day, it's completely negative. Doesn't mean that they didn't have the infection. It means the infection was very short, and therefore they didn't get to be symptomatic. So every country has got exactly the same problem.
And Minister, just as a final question, one of the key things that some of the viewers are talking about, and it keeps resonating, is the issue of corruption, which you started off with as well. With the IMF, whether or not it is going to be able to give some kind of assistance to South Africa's fight against COVID-19. Concerns have been raised, red flags have been raised that this kind of money may find itself in the wrong hands. What is government doing to try and ensure that that does not happen?
Well, it doesn't matter whether the money came from IMF. Even if it was our own government's money, even if it was a donation, once it gets involved in corruption, we need to really bulk at that. We need to actually fight that. We need to find out who did it and take action about it. What we then did, because President raised this issue at the beginning to say a number of leaders raised the question of a possibility of corruption, so we got the Auditor General. He comes into all the departments, particularly Department of Health, and those that are going to be involved in procuring or dispersing funds. They have actually come in and said, before we spend those monies, let's look at your system. How are you going to do this? So that we know if there's a risk and identify the risk ahead of time. So we've gone through that, all of us. And secondly, then they've said, then of course their reporting mechanism. If somebody is found to be corrupt, there must be a way of reporting and ensuring that the information gets out as far as possible. But thirdly, that they will come frequently, maybe every 3 months or 2 months, to come and meet with the officials in the department to see whether there are any areas where there's suspicion of any form of corruption. But if any of those things failed, then of course the president will do what he has done, where he signs proclamations for the special investigation units to track those areas where there are complaints that have been raised. We need to actually take this as a serious fight, because here we're busy fighting the infection, pandemic on the one side, but on the other side, as it needs resources, on the other side, we can't actually be undermining it through corruption.
And Minister, just finally, you were going to take us through, the modeling and what informs some of the decisions. And I know that you did have a presentation that you would like to share with us.
Well, I'll just say this very briefly because I did touch on it earlier. There are two things that we always try and look at. One, the models that get done tend to move ahead to track the possible new cases which are positive, going to be positive now and in end of the month and by end of August and September. And those numbers have shown that we'll have much, much higher numbers which are positive by the time we get to August. Secondly, it also tracks on the admissions, hospital admissions. Now, again, in this case, if you went back about 3 months ago, we were actually talking about 100, 200 people who were admitted. But of late, the numbers have gone up. At any one time, we've got very close to just over 10,000, 11,000 people who are admitted every day. And then, of course, we break it down according to various provinces. In June, the highest number of admissions was in the Western Cape. But middle of June, the numbers switched. They actually started increasing in Gauteng. And thereafter, Eastern Cape started also increasing. Of late, the numbers that are increasing on admission are KwaZulu-Natal. So we track all of this and look at what trends are we seeing. Now, in the Western Cape, the numbers of people who are admitted has started reducing. The numbers of deaths is still very high, but the daily numbers are much less than what we used to experience way back in June. So there are trends now that are showing that there's a change that is happening in the pandemic. So if I were to show you the slide, it would be showing us that the Western Cape took off and increased the numbers of people who were positive and peaked around 1,700 or so per day, and then started coming down around the middle, around the middle of June, and then started slanting downwards a bit on a plateau. There's still a lot of new positive cases, but it's less than what it has ever been. In other words, what the highest peak of daily increase we've actually seemingly passed in the Western Cape. We're approaching that number as well with Gauteng. Of course, we're not sure whether it's not going to start bouncing up again and increasing. But I've been, for example, the last week, talking to some of the leaders, some of the professors were saying they started seeing some empty beds. We do know that not all the beds are full, but we know that the numbers are going to still increase there. Then Eastern Cape, the same thing, although the numbers have slightly decreased, but we still got lots of positive patients there. So we're tracking admissions, they're still increasing, and therefore all of those are the numbers that we look at. In terms of where we should be, we still are concerned about the impact on August, because we think that August will still have huge numbers, especially the province of KwaZulu-Natal, because that one seems to be still rising still. In fact, if you look at today's numbers, KZN has had more numbers, very close to what Gauteng has on one day. So that basically means, therefore, that you're going to find different patterns of the spread of the infection in the different provinces. But nevertheless, the modelers had said to us, the peak will come in July, August, and September. However, the peak will be a bit less than the original numbers that they projected. So, because their numbers are, forecast numbers are very wide, we simply just look at the numbers and go and increase the numbers of beds and staff just to make sure that we don't get caught out. But we watch these figures on a day-to-day basis. We think that this is the major thrust that we're going through, July and August. Probably after that, we should get the numbers slowing down a little bit, but if we all were to use masks and wash our hands and sanitize, we would actually contain these numbers so that they don't get worse than what we're seeing now.
Minister, thank you so much for talking to us this evening and even engaging with some of our viewers who had the many burning questions and able to just put us in the picture there about just how things are looking and what government is doing to try and curb the further spread of COVID-19. And thank you so much to you, the viewers, for making this show, really an interactive one with all your questions. And unfortunately, we could not take, some of your questions that have been coming through, but we took as many of the questions as we could possibly have, and we do hope that the opportunity will once again arise where you are able to speak directly to the minister and get answers to some of the questions that you continue to have. A reminder now of the numbers. They now stand at over 445,000 confirmed COVID-19 cases in the country, and the number of deaths is now 6,769. Those numbers continue there, and the minister, even as he's wrapping up, touching on concerns around KwaZulu-Natal, as you would have seen that the numbers there in that province continue to, go up, and he says that concerns will remain, and even, around August, it will be the province to watch as the numbers do continue. And even the premier of that particular province earlier on, you would have seen his briefing here on Newsroom Africa, expressing concern with their own numbers as well in that province, and saying that government will continue to do what it can to try and fight the further spread of COVID-19, and also talking about the importance of behavioral change, that everyone needs to play their part here to ensure that the numbers and infections are brought down as much as possible.